Hi, I'm Dr. Sandesh Mayekar from Mumbai, India. I'm basically a general dentist. I started my career as oral pathologist, but then went into general dentistry. And then I introduced aesthetic and cosmetic dentistry way back in 1990. And subsequently in 2008, I did my post-graduation MSc from Tufts University doing TMJ orofacial care. And also I started doing implant about 28 years back. My first implant course was in 1987. So my main practice, I own 3 practices. I got specialist in my practice. I got hygienist to implantologist, especially 3 orthodontist, periodontist, etc. And basically we do everything what is necessary from pediatric to geriatric in our clinic. Friends, digital dentistry, as you know that AI has come, digital dentistry is very important. It starts from the patient entering the clinic. As the patient's record keeping has to be digital, so that we can send them the record with the history, with the radiographs, etc. So they enter the clinic, our clinic is digital to give them the digital records. Then we explain the procedure. We have got digital procedure explanation, where on touch screen we can show them what is cavity, what is implant, etc. When they sit on the chair, then we got digital, what we call intraoral scanners, to show them in the mouth what is exactly happening and what is cavity, etc. And also after the work is over, we can show them, see how the work looks like. So that intraoral camera as well. Then we come down to X-rays. People want to see X-ray immediately on the screen in front of the chair. They can see it by digital X-ray. We say RVG, what we call a small digital X-ray. If they want a full mouth, we got OPG, where we can take a full mouth X-ray. They can immediately see in about 25 seconds. Then comes the X-rays are 2D, two-dimensional. We want three-dimensional. For example, you want to put implants. We want to know the height, we want to know the width, and we want to know the thickness. So for 3D, we call CBCT X-rays. So that is necessary. So one can have that, and immediately we can get the report. Sometimes a root canal, we see the fractures in the tooth, etc. For that also CBCT is very, very important. Now comes a very important aspect that, okay, we showed the patient, we diagnose, now we plan, now we want to do, for example, a crown or cap or a bridge. Previously we used to take impression and there used to be some faults in the impression, material shrinkage, etc. Now it's digital, that is scanners. We can scan the tooth pretty well. There is no human error in that. And the most important aspect, we make the impression, we pour the model, technician will send their man, we send the impression back to technician, they pour, there is a problem in the pouring, there is a human error comes into construction, etc. But in digital, we scan and we immediately mail that scan to technician. He can print the model in 3D and immediately we get the model without human error. So that fitting, which is the most important, which I missed in first 20 years of my practice, which caused problem inside the crown, here the fitting is perfect. Including you do implant, we can scan the implant, make the impression of the implant, so that we can get implant prosthesis perfectly fitting without any problem. And that fitting is objective. Aesthetics is subjective. The fitting is good, the restoration will last for longer without damaging the inside tooth or inside implant. So that scanner is very, very important to have in the practice. So scanner. Then we have something called 3D printing in your own clinic also, or as we have in technician. So we can scan here, print, and the patients get a cap or inlays or fillings within an hour's time. Friends, digital dentistry is very important. But there is one part which is also very important, it's called ROI, return on investment. When you invest in digital, you have to calculate the return on digital. And the return on digital is how you save the time and give the precise prosthesis to the patient. And for that, digital is very important. If the precision is not there, you spend lot of time on the chair, and the patient is sitting on the chair. Instead of taking 5 to 10 minutes or 15 minutes, if you take 1 hour or 1.5 hours, that means you have missed 3 patients more. In that time, you could have treated 4 patients. So digital and analog, the difference is time saving and time is money. And the precision, you give the best treatment to the patient. Which is the best treatment to the patient? Is last long. Which lasts long? Where there is no problem after the restoration has been given. Saving time is saving money. So friends, digital is the only future. Learn digital and earn from digital. Thank you.